Hi everyone, welcome back to the second episode of the Social Prescribing Podcast. So, again with introductions, my name is Shahari, I'm the founder and chair of S4SP. In a fast-paced city like Dubai, we're seeing massive rises in lifestyle-related illnesses and social isolation. So traditional medicine is great at treating symptoms, but might not always be great at treating the root causes that causes these symptoms to appear in the first place. They may include, lack of physical activities or loneliness. So we founded S4SP to bring social prescribing to the MENA region, specifically the UAE. And our goal is to shift healthcare conversation from what's the matter with you to what matters to you, ensuring every resident has a pathway to holistic well-being.
Yeah, and I'm Arthur. I'm the co-founder and co-chair of S4SP. While Shahai focuses on the vision, I focus mostly on the strategy. My role is building the bridge between the medical community and the government. And S4SP is building this unified network that brings doctors, local communities and residents to champion the power of social connection. We aren't just providing medical prescriptions ourselves. Instead, we act as a communication hub where we raise awareness for social prescribing and unite those grassroots initiatives that are so key to implementing social prescribing. And really we're creating this dialogue between the people of Dubai and the authorities that to make those decisions one conversation at a time. So with us today we have...
Hi, so I'm Dr. Louise Lambert. I'm really pleased to be here. I'm quite excited about this topic. I've been a resident of Dubai for 23 years. I'm a psychologist and I'm also the editor of the Middle East Journal of Positive Psychology and now a workplace consultant.
Amazing. I mean, on that note, what's sort of easy is, what is social prescribing to you? We have many different perspectives. There's no clear definition. Varies person to person, profession to profession. But what does social prescribing mean to you?
Yeah, I mean, for me, social prescribing and this kind of fits the definition that at least ChatGPT gave me. And it's really the notion of medical professionals prescribing relationships. So what this could look like, and I'm just going to draw on my experience from Canada, actually working in primary healthcare. And what happened there is, you go to your doctor, maybe you're feeling a little bit under the weather, but there's nothing actually medically wrong with you. And the doctor suspects, I think there's something else going on here, and you could benefit from being connected to a community, more relationships, whether that's recreation, health, whether it's a cooking class, whether it's a bereavement club, whether it's a walking group, but in some way you are prescribed something non-medical. And there's a person in between who makes that connection for you to make sure that you go.
Perfect. Yeah, amazing. And Dr. Louise, you've worked so much in the power of positive psychology. And if you were to describe for our audiences, what do you think is the power of those social connections in the positive psychology and how we could see that in Dubai?
Start from the beginning. So our relationships are key, and I can't stress this enough. So for a long time, particularly in psychology, we really just focused on the individual. So what is going on inside of your head? How do you think? How do you feel? But increasingly, we're realizing that actually that's not really the best way to go. And when we have those relationships, either strong ties, friends, family, or weak ties, community relationships as well, people tend to do better. So their thinking changes, their emotions change, their state of health changes. So relationships really do add that extra layer of protection, but also of prevention.
Yeah, amazing. Yeah, we often hear.
We often hear, in science or in just general fields that loneliness is as lethal as smoking. So from a psychological standpoint, what actually is happening in a person, in their mind and in the mental health perspective when they lack kind of social interaction with others?
Yeah. So I think here's a good place to maybe describe there's two types of loneliness. So one is that type of loneliness when you're going through life transitions. So let's say, for example, you lose your partner. You're going through a divorce. All your kids leave home. And for a moment, it might be temporary, it might be a couple of months, but you suddenly find yourself with fewer social relationships than you like. Yep. That could sort of bring about that state of loneliness. But there's another kind, and this kind is even worse. And this is the kind where maybe you have people around you, maybe you have family, you have friends, or maybe you don't. But these relationships are not providing you with the type of connection that you need. So you feel lonely. And that loneliness really brings about a state of stress. And so that stress brings increase in cortisol, increase in inflammation, but the body goes on high alert. And this is also from an evolutionary perspective. We're not wired to be by ourselves. And so the minute we are, I shouldn't say the minute, sometimes you need to be by yourself, right? And that can actually be a big relief. But when you're on your own too much and it's unwanted, or the connections are not feeding you emotionally the way they should, your body responds as though it is under stress. And that over time has apparently the same effects as smoking 15 cigarettes a day. It's really bad for us, actually.
So changes in mental health essentially bring about physical ailments or reactions from the body.
So there's a physical consequence. I'm glad you mentioned that the mental consequence as well. It also changes how we perceive people. So again, when you're outside of your relationships and it's not by choice, sometimes that can motivate us to try and connect and find people. So this is where you might find the person going, oh, hi, could I come with you to that event? Or, oh, I'd love to be invited, right? Like we're motivated to find that connection.
FOMO, yeah.
And then for other people, particularly the ones where, maybe that is not wanted, something different kind of happens. That high alert sort of ends up being a little bit of mistrust. Distrust. What do you want? Why are you looking at me that way? Why is everybody trying to talk to me? And we start sort of perceiving people from a negative lens. So actually being lonely, especially when it's unwanted, creates more loneliness because it becomes harder and harder to actually connect with people because you don't trust them.
Yeah, and with that, it raises a really important point, I think. How do you believe people would be receptive to a doctor or a community ambassador trying to bring those connections on them in those times where they are lonely and they might not see that what they really need is a connection?
Yeah. So this is interesting because I've seen this happen in the workplace.
Wanting help, yeah.
Yeah. So again, you get the people who are like, yeah, I want to join. Those are easy because they're like, yes, please, find me a group, I want to go. But the ones who maybe are kind of on the fray, they're on the side, and they're really starting to be kind of cynical, mistrusting, and again, like doubting people. It becomes harder to pull those people in. And I've seen this in workplaces where people think, oh, they just need friends. Let's invite them to a pizza party. And then suddenly they get bombarded with people who want to be their friends. That's the worst thing you can do because now those people are like, see what I mean? Right? It's too much, but also really what's happening is we're not meeting that person at the same emotional state where they're at. So they want to feel seen and they want to feel understood. But if you're approaching them with, hey, let's go to a pizza party, you're not understanding them and you're not actually seeing them because their state is, I don't trust you and I'm not feeling very good about it. Yeah. Please leave me alone. But yes, it would be nice for you to get closer.
Yeah, so I think
it's a bit of a contradiction. So they actually become harder to approach.
100%. I mean, with that, also, my next question, it's an open debate with that. How do you think, as physicians, or once again, as community ambassadors, how can you really adapt to people's level if you see 100 people per day? Would that, does that limit the realisticness of social prescriptions in everyday life? What is your opinion on that?
I don't think it limits it. I think it almost augments the need for it even more, but we just need to do it differently. So it's about how do I let this person know, hey, how you doing? Good. Okay. And that might be the only contact we do that day. And then the next day, oh, hi, it's you again. What's your name? Bob. Okay, cool. Yeah, I'm Louise. Nice to meet you. And then we leave them alone. Day 3, we might go a little further. So it's about how do we rebuild their trust and meet them where they are at.
Yeah, it's
micro tasks, step by step.
Step by step.
Tiny. Yeah.
On top of mental health, it's kind of a growing theme or a growing epidemic, not only all over the world, but especially in the UAE. After COVID, non-communicable diseases are on the rise. But one thing I kind of find in the UAE is there's stigma towards mental health, even though it wasn't nearly as bad as it was in the 1900s, let's say. But there's still some stigma that's still left in some particular communities, especially Asian or even Indian communities, as they see mental health as for crazy people. psychiatrist. But how could social prescribing kind of help break that stigma and get people the help they need?
And I think this is kind of the challenge of the century when it comes to mental health, certainly, but in addition to social prescribing. So I think one of the issues that we have with mental health is that we've placed it in the heads of individuals. And that's where some of the stigma comes from. So by definition, it is about you.
Yep.
Right? So of course people feel like, why would I go get help? Because in short, the problem is me, right? I think social prescribing can free people up to say, yeah, actually that might be good for me, because we've placed the problem outside of them. The problem is in the spaces in between. The problem is we're lacking in community. The problem is everybody's on their phone. The problem is we don't talk to one another anymore.
Yeah.
The problem is we're losing trust between one another now. The problem is a social one. So I think that actually frees people up to say, yeah, I could get behind that, because it's about us.
I think
Instead of
At its core, social prescribing is kind of group initiative. So if you talk to people that are like-minded or have kind of face the same situations you do, it's a lot easier to connect, and maybe you can even share some common tips or some common coping mechanisms. Helps with the treatment of everyone overall.
But also you see that your suffering is not unique.
yeah.
Because suddenly people start saying, oh yeah, me too. Oh yeah, oh that happened. Here's what I did. But also it puts your problems in perspective, because you see, well, these 3 people dealt with it. Okay, well, I guess I can too. Whereas when you're obsessing about problems at 3 a.m., you really feel like you're the only person, because at that moment you are.
And I completely agree with that. And with your experience, maybe in broader terms, in workplace management, and how many people, many critiques of social prescribing might call it the placebo effect. Now, if a manager, for example, if you were to approach a manager and saying, oh, you're to boost your team energy, to boost the productivity of a workforce, you would need to augment their connections. They're feeling lonely. That's why they can't really work together. How would you tackle? And I see that it's a very open question, but how do you tackle with people who are skeptics, and how do you find a way to manage going around people who don't really believe in what you do?
Give them the data. So this is where I think science is always beautiful, and we don't rely on it enough. So there's lots of studies already being done in workplaces showing that when people are lonelier, they are less productive. They do take more sick leave. They are absent more often. It is documented. And in fact, they take more sick leave in line closely with people who struggle with mental health issues. And I'd probably say a lot of people who are lonely, especially the non-voluntary ones, there are mental health issues there also sometimes. So those numbers exist. So
it's behavioral action, that's the data behind behavioral action.
Yeah. So, I mean, there's a big study done, it was just published a few years ago by Cigna Insurance in the US, and that's publicly available. You can even just Google it, showing that, again, lonely people are absent 7 days out of the year versus non-lonely people, it's only 1.5 days.
Yeah.
Right? So just that, so helping those social connections can reduce a lot of the things that companies lose money over at the moment anyways.
Yeah.
And so with that, I think, Shahari and Doctor, do you believe that if we were to try to raise awareness and try to convince people and government bodies, would you believe that this economical profit that people would get is a nice incentive also to start with? Do you think it's one of a deciding factor, perhaps? Do you think it's something we should include?
I think we should, but it's always remarkable to me how sometimes we have data and people go, nah, I don't want that.
I think cost is a drive.
Cost is a driving kind of motivator, especially for governments. That might be a key reason why it was so successful in the UK. The very nationalized healthcare system. Everything is on the government's dime, and when the government hears savings, they love the idea.
Yeah.
I think it's quite different here. It's a very privatized healthcare setting. So on that route, you have the research aspect, and I can tell you, from our personal experience, me and Arthur are trying to get published about specifically social prescribing research here. It's like a black hole. Usually when you do write a research paper, you reference data unless you're creating the data yourself. There's no data to reference practically. Maybe a few reviews here and there, but in practical senses, there's no original data to refer back to. How can we kind of fill that void? And also, what might be a potential incentive to privatized healthcare providers to adopt social prescribing?
Yeah. Oh gosh, that's again the question of the century. And if I could crack that nut, I would steal it from you. So I think it's again raising awareness, talking, but bringing it down. I hate to bring everything down to money, but that's when people pay attention.
Yeah.
So it's either a savings for public, for private, and I hate to say this, but could you make money off of doing this? I think you could somehow. And it's to, how do you match people with the correct services? Could there be an avenue there? I think another way is pairing up with academia. I'm happy to work with you. But also to say, let's try a pilot program, right? Because there are some companies I've been speaking to, and most are like, loneliness? No, or people aren't lonely. I think we don't understand what loneliness looks like. We think it's the person crying in the bathroom, but it's actually just that quiet person over there who hasn't spoken for 4 days.
Yeah.
That's loneliness.
I think even loneliness.
Loneliness can be triggered by other factors, concept like if you're a diabetic patient, you might be lonely not because of the care. Maybe you might feel depressed because you're always surrounded by medication. It reminds you of the dark ages or whatever. But loneliness can also be a compounding factor of a physical condition that you have.
And loneliness does make physical conditions worse, right? And we also know that loneliness actually kills people sooner, right?
Yeah.
Like they live less.
Yeah,
and less long.
Maybe.
And
less long.
maybe moving out and looking at the UAE. In the UAE, we see often I'm not making something new to you, but we often see that there's a sense of ruthless clinical depression. Now, how do you think social prescribing or connections can help with that, or even cannot help with that? It's more of a topic on ruthless clinical depression, but how do you believe we can address this issue in the UAE?
Yeah. So first, let's stop calling it rootless
clinical
depression.
It's
It sounds like some bad disease.
No,
It sounds very scary.
No, I meant like it's
I understand.
the critiques call it
Yes. Let's stop calling it rootless clinical depression. It sounds like some bad disease. It sounds very scary.
By Arthur.
I meant like it's
I understand.
The critiques call it
Yes, I understand exactly what you're saying. And that's what I mean. Sometimes it's like, can we use different words for different things? Because the minute we start using all our big clinical terms, people are like, do I have, oh gosh. And then, depression, clinical, it's scary. What if we could better educate people about what it means to be an expatriate? What are some resources? So this is one of the first things that I did here, and this is always on my list. It doesn't matter where you go. I know I need a place to live that's quiet, because if I don't have my sleep, I'm very grumpy. But also, I need to make friends and quickly. So, and a lot of people, I think we don't realize that we need this until we don't have any. And when you don't have any, that's the worst time to try and make some. Because now you're going to sort of latch on to anyone, and that might increase your loneliness because maybe they're in your life, but they're not giving you the social connection that you need. So I think in part, again, it comes back to your point, is how do we raise awareness that this is a need. It's a psychological need. So there's job, housing, but we really need relationships. And could we just call it that?
Yeah.
Have you met your basic needs? Today, this week,
it's like
this
the
month.
pyramid of
Maslow's hierarchy.
Maslow's pyramid.
I remember that from psychology.
I should hope you do.
Psychology. But on the topic of relationships, UAE demographic is quite unique. It's majority expats from various countries around the world. While let's say the US or UK, it's largely a native population. Obviously, there's your expatriates, but here it's a large proportion. And like we say, continuity of care. Many expatriates, or the majority of them, stay here for 5 to 10 years, let's say, and when they do eventually retire, they go back to their home country. So another kind of problem that I propose to you is how do we make sure they continue to receive the care that they received here? An example would be they're in a walking group program, or they're in a group program in general, and they meet weekend or weekly in their near park, in their neighborhood park. When they move back to their home country, they would have none of that. Obviously, you have WhatsApp, Instagram to keep in touch with people, but like you said, keeping in touch with people through technology doesn't have nearly the same effect as physical interaction. How might we kind of cross that hurdle?
Well, and this is where, given that it's a prescription, if we think about it in terms of medication, your medical prescription would follow you.
Yeah.
So the social prescription should follow you as well, right? So now you're going home, let's review how things have been going. What do you need when you get there? This prescription needs to be maintained. Who do you want us to transfer this prescription to?
Yep.
So, and I hate to medicalize, but maybe it's got advantages to medicalize relationships, because then you've got it on a piece of paper. I need this.
Yeah. Essentially, it's like a transfer of social prescribing
Transfer
care.
of patient. Exactly.
And maybe like widening this. I like to widen this.
Yes.
But if a doctor, okay, who's watching this podcast wanted to maybe not prescribe socially, but take a step into social prescribing, if he wanted to do that and start taking that with his patients, what do you think is the one psychological barrier that he would need to address first with his patient?
So I'm going to start with the doctor first. I think for professionals, it's being aware of what are those services. Because we have a tendency, professionals, in whether it's medicine, psychology, that we know everything. Of course, that's what doctor is in front of my name for, And then you go out and you see these community groups and you understand what they do and what they have to offer, and you go, oh, that's very good. Now you can speak to it. Now that is easier to convince your patients to say, I actually know this woman. I met her. She's amazing. This is what they do. Versus, here's a brochure. Good luck.
Yeah.
That goes nowhere. So being able to really speak to it and be convinced, and to use the proper words, and to say, look, I know this is going to be awkward for you. Why don't we try this as an experiment?
Yeah. Okay. So with that, would a role for students for social prescribing to maybe raise awareness of communities to doctors?
Yeah.
And maybe like link them up. Would you say that's an essential step?
Yes, I think that'd be fantastic. And I would go even a step further, that it's incumbent upon, maybe this is a bit of a big requirement, but those community groups, not just what can they offer, but what is the outcome of that?
Yeah.
So for them to start thinking about, how does this improve people's health? How does this improve, physical health,
On the topic of, kind of connecting it to things that people are familiar with, I think that's a great way of connecting, or like, oh, it's like that. So in the UAE, you have the Majlis system, and that's essentially like the OG social prescribing, where they get together, they discuss, they talk about everything, they debate. That's like the OG kind of social prescribing. Original social prescribing.
I should know that, but okay, OG.
Original social prescribing. Ancient social prescribing.
Okay.
Do you think, we can kind of connect the majlises and turn it into, I wouldn't say social prescribing centers, but where they can provide some of the activities that we call social prescribing?
Yeah. And we call those community centers. Wouldn't it be nice to have some of those here, right? Yeah. No, I love that. And yes, and that's a great example to show that, this isn't some weird thing that's being brought into the region. People have always acted collectively to take care of one another. And I think in many cultures, certainly in the West, we've lost that 100%. And this is something that the UAE and many of the Gulf countries can offer as a great example of, this is how we do it, but this is why it's important, and this is why we keep doing it. And, to kind of find ways, and maybe we keep the name, a community majlis where everybody can go.
Yeah.
Right? And it's really a community center.
Yeah.
Where you can go work out, you can learn how to do cooking, you can have conversations, you can debate the meaning of life, but you can also meet people and connect and feel like, these are my people.
Yeah.
I belong here. This is my group.
And with that, I'm sure you can predict what I'm going to say, but to widen the perspective, the UAE has started to use AI a lot to try to connect people the doctors and try to put everything into a nice, clean system that's just much easier to use instead of 5 different systems per emirate.
Yeah.
And they used the Turn AI, which is a fantastic, led by a fantastic CEO who's really a visionary leader. I truly believe he's an amazing person. And, with that, do you think there's a chance for social prescribing to be discussed in using AI to connect those communities with those doctors and follow up on those procedures? Do you think that technology could be used in that? Because my question, it's more than just the obvious yes, because the interesting point that I think could bring is whether technology can be used and not push people out.
Right.
Like separate people by using
It's
technology.
like a very in-person thing now, isn't it? Like social prescribing now, like especially in the UK where it's official,
Yeah.
everything is like in person. Art classes in person, our discussions in person. How would that work on like Zoom calls?
It's kind of weird. It's not quite the same, is it?
But maybe could AI, like Arthur said, help with maybe efficiency in some operational capacity? Could it be?
Yeah.
Oh, I'm of two minds on this. So I'm doing a lot of reading about, of course AI is wonderful and it does all these great things. And then on the other hand, it's like, oh no.
It can destroy the world.
It can destroy the world. But also, people are connecting with their AI chatbot person, boyfriend, girlfriend, husband, whatever. So it's kind of like, how do we keep people safe while helping them through AI? And I don't have the answer to that. And I think that's going to be the next frontier for mental health and psychology and medicine and everybody else, is to think about how do we do this that meets people's needs, but not so well that they forget that they're speaking to a machine at the end of the day.
It's like a machine, so we have to kind of maintain that perspective, I think it's developed so far, like Claude and other AIs, like it's developed so far where it talks like a human, but at the same time, you sometimes forget that you're not talking to a human. It's scary.
Cool, awesome, I love it.
It's like, I'm talking to a robot that remembers everything I say. I might prefer a human instead.
Or I prefer the machine instead.
Yeah.
Because now, by contrast, humans are so uncaring and not very nice and not very sympathetic, and they don't agree with everything I say.
And with that was actually my question, maybe not completely linked to social prescribing, but mostly on your opinion on how could, the ChatGPT is very known, for younger generations, but ChatGPT is very known to be the AI that will agree with whatever you say. Claude is the AI who will disagree with whatever you say, and the Grok is the AI who will stay neutral to whatever you say. So with that, how do you believe that impacts macro psychology, the psychology of people as a whole society? Because if people get used to being agreed on or not agreed on, how do you believe that impacts our society?
Yeah, so I think, again, this is evolving. This is a great worry. And I mean, we're already seeing a lot of research just in terms of young people. The more you use AI, the less you're actually cognitively developing. It's a big risk factor. The more you use the type of AI that agrees with you, the less you see or even seek out alternative views. The more you're disagreed with, maybe that's a little bit different. Generally, the other angle is the problem. I don't have the answer to that. I really don't. I really don't.
It's just something to store and then we
I think maybe in a year or two we'll be like, yes.
In a year or two, probably like next month. It's going so quickly.
Yeah.
But I think a final question would be, how do we frame it to insurance providers? How do we frame it, guys? Here's a business opportunity where you can make money and it'll help people at the same time. How can we frame it to them?
To expand on Harry's point. How can we frame it, do you believe? And I'm also giving you time to think about this.
That's what I mean.
How could we sell this as something both economical, because it can be profitable, but at the same time, you viewer, you're not the point is we're helping you. It's okay, it might be beneficial economically for society, but it's also helping the people. So how can you frame into one policy both things? How I know it's a very big question, but do you think we should target mostly the psychological aspect, the physical aspect, for example, running clubs for weight loss, or mental health for, that's an open question,
And I'm trying to find that same answer. in terms of, thinking about how do we promote, sell, capitalize upon well-being, evidence-based well-being. And I think it's bringing people back to, what is important here. So one, health, well-being, but it's hard to make money off of that. I shouldn't say it's hard to make money off of that. I think there's just more money to be made off of illness and ill-being.
Yeah.
So that's kind of where our attention goes. I don't know. Gosh, I'm not very...
Maybe you could... Maybe here's...
Here's my 2 cents on it. Maybe we can frame it like it already exists. I'll give you an example. Where type 2 diabetic patients struggle with their diet, many hospitals provide nutritionists who provide diet meal plans. That's a form of social prescribing if you think about it. So then obviously insurance providers have a code for it and it's paid for.
Yeah.
Maybe there are insurance codes and certain activities that already exist there. We just need to put it under the umbrella of, or call it social prescribing.
Or the definitions to be widened.
Yeah.
So certainly, I'm thinking about positive psychology. So this has been used in healthcare with patients. Typically, it's used under the guise of promotion and prevention of mental health issues. But of course, the vast bulk of the money goes to mental health treatment, which is fine. That's where the need is the biggest. But I think what is very hopeful to me, and you've noticed this as well, is, we're talking a lot more about longevity now, well-being, wellness, and people are looking for prevention and promotion. But I think businesses are also going, hey, there's a way we can make money here, so let's capitalize on that.
About this in our previous podcast with Dr. Rami, and he also mentioned that the enormous amount of market share that is yet to be untapped in the sector of wellness, and the enormous amount of people that could be affected by wellness. All of us can be affected by wellness and prevention, because you can never be too prepared or too prevented for something.
And I would go further in that. So I think we're still seeing it as, we need to do this to prevent illness. But even if you're not ill, even if you're not struggling with something, just to elevate everybody to be at their best.
Yeah. Maybe to close everything off.
And why now?
And why this? It is a bit widening, but the UAE has, have maybe not called it in the social prescribing, but for example, Dubai 30-30. It brings people together, they do sports, at the end of the month, they're fitter normally.
Yeah.
Now, they never called it social prescribing, they've never called it something like that, but it was a national policy. If you had to tell our viewers who are watching this and who maybe be thinking, I've seen things around social prescribing, if you had to define again, linking back to the beginning, what would social prescribing be, and what has social prescribing, what was social prescribing in the future? What was social prescription in the future? If you had to describe it like a short line, for example.
Okay, wait.
I think something.
I didn't think about that. Well, I think it's taking advantage of what is available, and we often don't do that. We think of, what's on? What's an event? What's a concert I can go to? But we also should be thinking about, what do I get out of that psychologically? What do I get out of that socially? And sort of seeking out these events. It's not just an event you're going to, but to think about it as, this is a vitamin you're taking. It's good for you. It's going to prevent other things. But sometimes it is a little bit like a treatment. Maybe you've been feeling low all week, all month, and this is exactly what you needed. So 30-30 is a great example of that. But even things within organizations. I think about, third spaces, art galleries, museums. Abu Dhabi, the Louvre, they have a great art program, right? Where people just kind of connect and they're going to, draw together. But it's structured, so you don't have that awkward, hi, I'm so, that nobody likes that. But when it's structured, there's an activity. Here's why. What do you think? How did this go for you? People are more likely to go because now we're talking about that instead of each other.
Yeah.
So it's about thinking, how do you want to connect to people in ways that are safe, that are easy? Go find those events and,
kind of like in this market we're talking about. Do you agree regulation by the government is an important first step?
It does everything.
Regulation by the, obviously an unregulated market, it can help, even millions of people, yes.
Yeah.
But it also has its disadvantages, you know. It's very unregulated, people might fall for different things, you know, and no one's to blame, you know,
Yeah.
so if a negative side effect happens. So do you agree, going to the government first, having a conversation with them, regulating the market, should be the first step for any organization that advocates for social prescribing?
Even if you don't build a relationship, you got practice
Yeah.
with those social muscles, saying, hi, how are you? Oh, yeah, I'm from here, I'm from there, da da da, da, talking about whatever. Even if you never see them again, you were seen, you were validated, you were heard, you mattered, even
Yeah.
for a few minutes. Like that in itself is a huge boost.
Amazing. Well, thank you. Well, thank you very much, Dr. Louise Lambert, for your time.
pleasure.
It was
Thank
great
you.
talking to you. I think it was very valuable insight that we had. Thank you very much for watching. We hope you enjoyed. Remember to follow and probably like the video as usual. And
We'll see you in the next podcast then. Yeah.
have a wonderful day. Thank you.